morning, everyone. My name is Kira. I'm a student physical therapist assistant. Today I'm going to be working on case study number 2 with Phoebe Buffet. Date of birth is 4/4/57. Her primary diagnosis is arthritis in the left hip. She's had this for 10 years and it's been giving her pain with her ADLs. So she opted to have a left total hip replacement, posterior approach. So today we're going to be working on supine to sit, sit to stand with min assist and mod assist. We're going to be teaching her how to use her rolling walker. Her medical history does include cardiovascular disease and hypertension, so we're going to be monitoring that through our treatment. Other than that, she has no other contraindications. She does have good sitting balance and her standing balance is fair, but her dynamic balance is poor, so we'll be monitoring that. And let's get started. Good afternoon, ma'am. My name is Kira. I'm a student physical therapist assistant. How are you doing today?
Good. How are you?
I'm doing well, thank you. What is your name and date of birth?
Phoebe Buffet, 4/4/57.
Perfect. That's what I have as well. So I understand you had a hip replacement on the left. Is that right?
Yes.
Perfect. That's what I have too. So before we get started, all your contraindications are clear. When's the last time you took your hypertension meds?
Maybe like 30 minutes ago.
30 minutes ago. Okay, great. And you're managing that pretty well?
Mm-hmm.
Perfect. That's what I have as well. So today I want to work on a couple of things. We're going to measure your hip strength, or I'm going to measure your knee flexion. I'm going to take your blood pressure as well, and then we're going to do some passive range of motion and then some
Different exercises.
Does that sound okay to you? Perfect. So let's go ahead and take your blood pressure. Do you know what your normal blood pressure is?
Like 120/80-ish, but I've had some caffeine this morning, so it might be a little bit more than that.
Okay. So I'm just going to go ahead and put this pillow under your arm. Okay, great. So I did get 120/80. And below 120/80 is considered normal, but I'm not worried about you today. Okay? Any questions about that? Perfect.
Good timing for my medication, I guess.
I know, that was great. Alright, so now I'm going to go ahead and measure your hip extension strength. So I'm going to put these in between your legs here. Are you aware of your hip precautions?
They told me I can't tie my shoe essentially with bending, and that's all I remember.
Okay, so your precautions include you're not going to bring your knee up past 90 degrees in your hip, and then you're not going to bend over past 90 degrees in your hip. Does that make sense?
Yeah.
And then you also don't want your toe to come to the inside, so we don't want to internally rotate your feet, at least on the left side. But then you also don't want to bring your left leg to the inside of your body. Does that make sense?
Yeah, at all, or can I cross my legs, or?
Nope, no crossing legs. So that's why we're going to use these pillows today to help us do some rolling and such. Does that make sense?
Yeah.
Okay, so I'm going to lower this bed a little bit. What we're going to do is when we're set up, I'm just going to help you roll. I'm going to assist your left leg as much as you need, but you're going to try to roll by yourself, and I'm just going to help you. But then when you're going to lay on your belly, and then I'm going to have you pick your leg up like this off the table, and then I'm going to give you some resistance and count 1, 2, 3, and then we're going to do the same side on the left. Okay. Does that make sense?
Yeah.
I'll lift you up just a little bit more. Alright, so go ahead and prop up on your elbows. And then you're just gonna roll over to your belly normally, and I'm just gonna help this leg.
Like that?
Yep, great. Okay. So I'm gonna take these pillows from you now. Alright, we're gonna do the right side first.
Okay.
Alright, so go ahead and pick this leg up, keeping it straight. Okay, great. And now you're gonna lift it halfway, and then I'm gonna give you some resistance,
Okay.
but don't let me push, okay?
Mm-hmm.
1, 2, 3. Okay, great. Alright, so now we're gonna do the left side, so go ahead and pick this leg up, keeping it straight. Okay, great. And now do it halfway up, and don't let me push you down. 1, 2, 3. Okay, great. So I rate the right side 5 out of 5, which is normal, and I would rate the left side 4 out of 5, which is to be expected, and that's something we can work on during therapy.
Okay.
Okay? Any questions about that?
No.
So now I'm gonna put this in between, and I'm gonna help you roll once more. All right. So now prop up on your elbows again, and then just roll towards me. Yep, all the way. Okay, great. How are you feeling?
I'm okay.
Okay.
Most moving I've done in a while after my surgery.
Yeah. What would you rate your pain at today?
Like before doing all of this,
It's kind of bad. How do you want me to rate it? How would you rate it, like 0 to 10?
probably like a 6, honestly.
A 6?
Yeah.
Okay.
But they did give me my like pain medication when they gave me my hypertension medication.
Okay, great.
So I
That should be kicking in.
Yeah.
Okay, great. So now I'm going to measure your range of motion in your knees. So we're gonna do the right side first. So I'm gonna put this bolster under your knees, or your ankles here. And we're gonna do this side first. So what I'm gonna do is line this up with your knee, like the middle of your knee. This is gonna be towards your lateral malleolus, and then this is gonna be towards your greater trochanter. And what we're gonna do is I'm gonna line it up, give you some overpressure to measure like any hyperextension you might have. Normal knee extension is 0, but having a little bit of hyperextension I'm not worried about. And then normal knee flexion is 150, but we'll see what we're at. So we're just gonna do one big movement, okay? Okay, great. So I got 7 degrees there. Go ahead and pick this up. And then I'm gonna give you some pressure. So I got 120 there. So 150 knee flexion is normal, but you're very muscular, so I'm not worried about your range of motion in this side. So when we're measuring this side, we have to make sure that we're not bending our hips past 90. So we're gonna put this pillow here to remind us. All right, so same thing on this side. So now I'm gonna give you a little overpressure, okay?
Okay.
So I got 7 degrees on this side as well, so that matches. And now we're just gonna lift this up. And we're just gonna do what we can. Okay, so we're just gonna keep our legs there, and I'm just gonna give you some pressure here.
Okay.
Okay. So I got 102 on this side. So normal is 150, but our goal for us is to just make your legs symmetrical.
Okay.
Okay? So we're gonna work on that in therapy, okay? Any questions about that?
No.
So now what we're gonna do is is I'm gonna do some passive range of motion on you. I'm gonna do 10 reps, okay? So if you want to slide towards me, okay, great. And I don't want you to even do anything, you're just gonna relax, okay?
Okay.
And I'm just going to help you move your leg, get some range of motion back, okay?
Okay.
So you just relax. So go ahead and straighten this leg out. And we're gonna do 10 reps. Okay? Now you can scoot back a little towards the middle. Okay. How do you feel?
Okay.
Good? Does that help you feel a little bit more loose?
Yeah.
Okay, great. So now what I want to work on with you is we're going to go from supine to sitting on the edge of the bed. We're going to make sure that we don't break any precautions, so I'm going to help you. I want you to do as most as you can, and I'm just going to help assist your leg.
Okay.
Okay, so what I want you to do is we're going to scoot towards me again, towards the edge of the bed. Okay, and now what I want you to do is prop up on your elbows. And now, as soon as you lean up, this leg needs to come down off the table. You can use this leg as much as you can, use your arms as much as you can, and I'm just gonna help you, and we're just gonna like swoop.
Okay.
Does that make sense? Okay. So, let's go ahead and start bringing this up, and you're gonna start swiveling. Alright. How do you feel?
Okay.
Good?
Yeah.
Alright, we're gonna do 5 more reps of that. Okay? So go ahead and start leaning back again. And then you're just gonna swivel back onto the table. Great. Alright. So a couple more. Let's do 2 more here. Alright, so prop up on your elbows and then come towards me. Okay, great. And now you're gonna start swiveling this way. Perfect. Alright. So now let's go back on your back.
What do I do again?
So start leaning back,
Okay.
and then bring your one leg up. Alright.
Cool. So we're gonna do one more of those, but before we do that, I'm gonna go over a couple of things. The first thing I want to go over is, do you know what your weight bearing status was for your hip?
No.
Okay, so what you have is weight bearing is tolerated. What that basically means is you can put as much weight as you can on that left foot to where you can tolerate it. We don't want you to have pain, but you don't have to be completely off of it. So we want to do as much weight as possible so we can get you up and moving to go home. So, how tall are you?
5'7".
The biggest thing too with this walker, I don't want you like this. I don't want it like this either because it's kind of like a hazard. Like a good in the middle part. Okay? I'm gonna be holding on to you the entire time. How I'm gonna be doing that is with this. This is called a gait belt. So what this is gonna keep both of us safe. Is it okay if we use this?
Yeah.
Do you have anything on your stomach that I should be worried about that would be irritated by this?
No.
Okay, awesome. Alright, so I'm gonna show you how I want you to walk when we get you up. So you're gonna kind of be standing into it. You're gonna go walker, left foot, shift your weight over, bring over your right. Make sense? Cool. His knee. And start shifting. Swivel, swivel. And then come up. Nice, awesome. So, put this here because when you stand up, the moment you stand up, grab onto this, okay? And how you're gonna stand up is I'm gonna help you kind of tuck your legs in a little bit. Well, this one's gonna be slightly tucked in actually, just because remember you have that weight bearing is tolerated, so you can put some weight on it. We just don't wanna have that bend right here. Once I get your feet positioned, you're gonna kind of lean forward. That's gonna help your butt get up. Once your butt starts to get up, you're gonna push through your heels. Once you're fully up, you're gonna grab onto this.
Okay.
Sound good? Okay. So, let me put my Bend this knee just slightly, right there. You can put this one behind you a little bit more. All right, lean forward. 1, 2, 3, yep. Awesome, and then put this hand down, just one of them. That seems like it fits you fine. Okay, you feel okay? Starting?
Yeah.
All right, so what we're gonna do now for you to sit down, you're gonna put your hands behind you, kind of to reach the back of the table. Then you're gonna bend at your hips. You're gonna kick this leg out a little bit and then sit down, okay?
Okay.
All right, so whenever you're ready, let go, reach for the bed, start to bend. All right, how'd that feel?
Fine.
All right, so we're gonna do a couple more of those, okay? Ready? Lean forward and up. Good. You ready to do some walking?
Yep.
All right, so we're gonna kind of turn it this way. So turn to the side, left foot, right foot. All right, do it again. Left foot, right foot, and again, left foot, right foot. Okay. You okay?
Yep.
A little wobbly?
A little bit.
Okay, that's fine. All right, so we're gonna take a couple steps. We're gonna go to the end of that second table right there, okay? But we're gonna go at your pace. So you're gonna push the walker first. Left foot, right foot. Walker, left foot, right foot. You doing okay? Walker, left foot, right foot. Good. All right, so we're gonna turn around. How I want you to turn around is gonna be kind of penguin-like, but with a step, all right? So I'm gonna have you turn to your right. You're gonna move the walker towards the right. Take a step with your right, and then have your left, come over. That's gonna help us keep into those hip precautions, all right?
Yeah.
So slight to the right with the walker. You can make baby moves. Right foot, or just do it, left foot. Good, all right, walker, right, left. Good, good. Walker, right foot, and then left. Awesome. So that's how I want you to walk so you avoid breaking those precautions, okay?
Yeah.
That way you're not crossing over. All right, we're almost done.
Yeah.
All right, so you're gonna push your walker again, left foot, right foot. Good. Walker, left foot, right foot. Good. It's okay. All right, we're gonna do that same type of turning, okay?
Okay.
So you're gonna do your walker, turn your right foot, left foot. Walker, right foot, left foot. And now we're gonna walk backwards with that same thing to get you to sit down, okay? So bring the walker to you. And you're gonna go left foot back, right foot back. Do that again. Well, it's okay. Walker, left foot back, right foot back. For that, the back of your legs? Alright,
Yeah.
remember how we sat down earlier? So we're gonna do it just like that. Kick this leg out a little. You're gonna put your hands behind you. Good, good. Alright, how you feel?
I want some Jello now.
Some Jello? How about I get you some? See if we can get you some afterwards, okay? Alright, so, and then how we got back into the bed from earlier, we're gonna do that same type of movement. So I'm gonna have you with this, and then you kind of swivel. How you feel?
Good.
Yeah, alright, so we have one more thing to do, and then this is gonna be helpful for when you go home. This is what I want you to work on, right? So it's gonna be a couple of things, I'm gonna explain them, I'll do them with you, make sure you know how to do them, and then if you have any questions, we'll go from there. Have you ever heard of a glute set?
No.
Alright, so, what I want you to do, I'm gonna explain it. Glute sets, we're gonna do this for 10 reps, but with 10-second holds. With glute sets, it's basically, I want you to squeeze your butt cheeks as hard as you can.
Okay.
And we're gonna do that, hold that position for 10 seconds, and then you're gonna relax, all right?
Okay.
You're gonna know you're doing it because when you squeeze your butt cheeks, your hips are gonna come forward some,
Okay.
okay? So go ahead and try to squeeze your cheeks as much as possible. All right, you see how that lifted up? All right, 3, 2, 1, relax. But remember, we're doing that 10 times.
Okay.
We're gonna do it again just so I make sure you know what you're doing.
Okay.
All right, go ahead and do it for me. What are you doing?
Squeeze butt cheeks.
All right, you wanna count down?
10, 9, 1.
Relax, good, awesome. So this next one, we're also gonna do 10 times, also do 10 seconds. But this one, I want you to feel like you're pushing the back of your knee into this table.
Okay.
first. You did one at a time.
Okay.
Okay? You're gonna push down. All right, count down.
10, 9, 2, 1.
Awesome, great. So we're gonna go ahead with the left. You're gonna, kind of push that knee all the way down. And how you feel that is you should kind of feel your foot. You see how it's coming up some?
Yeah.
All right, so do it again. Push it down. Your foot should come up and count down.
10, 9, 2, 1.
And relax. Okay. So again, you're gonna do that. How long are you doing that for?
10 seconds, 10 times.
Good. And then how do you know you're doing it correctly?
And my feet come up.
Okay, come up like to the ceiling, or how else do you?
Just up from the table.
Okay. All right, so now this last one, it's heel slides. Have you heard of this one?
No.
Okay, so how we're gonna position you is your knees in a second here are gonna kind of be like bent, like that. And then I'm gonna put a towel underneath your foot so we can help you, and I'm gonna show you on your right side first. You're gonna go all the way down, your legs gonna be straight, and then you're gonna come back up. Kind of like what we did earlier when I checked your range of motion, knee to ceiling. That's what we're really looking for. The important part is we don't want to bend the hips too much, so we don't want your knee to come towards your face. It's really towards the ceiling, okay? Crick your foot up here. All right. Actually, bend this knee for me. Bend it, knee to ceiling. All right, so that's good. You see how your hip's not at that 90? This is really where I want you to be. I don't really want you to go past this. And then what you're gonna do is you're gonna kind of go like that. Your leg is straight. And then bring your heel back up. Great, and then back down. Awesome. So if you feel like you're having trouble with this one, the towel is really great to use because the towel will help you ensure that you're keeping your heel in contact with the ground or the bed, wherever you end up doing it. Because what I don't want you to do is I don't want you to be like, oh, I'm gonna lift my leg up, let me bend it. It's not what we want, okay? So now we're gonna try this on your other foot. I'm gonna lift your foot up here. All right, and this one I want you to do it. I'm gonna see if you can do it. So whenever you're ready, slide back. Okay, that's fine. And then you're gonna go back down. And then you're gonna do it again. And you're gonna go back down. So for this one, it's not gonna be a hold like the other ones. I want you to do 3 sets of 12. The important part is, like I said, you wanna maintain your hip precautions. You don't wanna break that. If you're able to get more knee to ceiling while still being in your precautions, great, do that. So those are the 3 that I really want you to do. What I kind of want is, let's go over a couple things, right? What were your hip precautions?
Not bend my hip past 90 degrees. Not bring my toe into the inside. And not crossing my leg to the inside. Okay.
Good. And then what is your weight bearing status?
As tolerated.
And what does that mean?
As much as I can.
Right. Okay, good. What are the 3 exercises I want you to do at home? And I want you to tell me what you're doing for like how many times?
Glute sets, 10 reps of 10 seconds. Quad sets, 10 reps, 10 seconds. Heel slides, 3 by 12.
Right. Great. Do you know that you're doing the glute sets correctly?
And my hips come up.
Okay. What about the quad sets?
And my feet come off the bed.
And then the heel slides, what's important about that?
Not going past 90.
It's another important thing.
Not lift my foot.
Good. Great. So you know all of those. Awesome. Do you have any extra questions for me?
No.
Alright, so what I'm going to do, I have a sheet that actually has all these home exercise programs on it. So in case you forget, you already know what they are. So these are it right here, okay? So like I said, they have that glute set, quad set right here, and then the heel slides with everything that you want to do. Do this twice a day to help benefit you. So I'll put this over here with your stuff. I will put your things right here. You have your call bell in case you need to call anybody. You have your phone. But that is really it. Like I said, unless you have any other questions for me. Awesome. Okay, so I hope you feel better. All right, have a good one.